The following webinars for this series will happen in due course time, but this is the first event for this topic on language and terminology. And I will pass over to Naomi, who will introduce this event from the perspective of LSHTM. Thank you.
Thank you, Denise. Good evening, everybody. My name is Naomi Stewart. I'm a communications manager at LSHTM, and I've been supporting the Institute on how we can improve when it comes to racial issues that we're facing within our university, but also more broadly within global health and within research and academia. And as part of that, and a very important part, is how we use language and terminology to refer to different groups of people, whether that's within the research, within the communications that are coming out from universities to staff, student, alumni, and world more broadly. So with that, I would like to introduce our speakers, who will say a little bit about themselves, and then we'll start the conversation. So can we start with Sheena? Would you like to go ahead?
Hi, everybody. I'm Sheena Kalayil. I teach at the University of Manchester. I also did a doctorate in sociolinguistics when I looked at the narratives of second generation South Asian Britons. But I'm also a writer, and I have 3 novels published with a small independent press, Polygon. I think in our pre-webinar conversation, we also decided that we'd start off by telling everybody how we identify. And our immediate reaction is that that's quite complex and it might take a while. I'll try and make this short, but I can probably say that I probably most identify as an overthinker, and hence this will explain my response. It's not easy to answer that question because I don't identify as any one thing. People might make assumptions of me when they see what I look like and how I sound, and I'm probably quite happy to sort of challenge those assumptions in how I respond. I am Indian, but I'm South Indian. I didn't grow up in India. I spent a lot of my childhood in Zambia and Zimbabwe. And I came to the UK as an international student. I didn't stay here. I worked in many other countries after graduating, but in the end, I have arrived in the UK, and so I'm an immigrant. But I don't feel like that tells a full story because I tried to be an immigrant probably 2 or 3 times before that in different countries, and so I don't feel that Britain deserves the privilege of being the host country for my migration. It doesn't tell the full story. I'm also a wife. I'm a mother. I've been quite recently a student, a postgraduate student. And like I mentioned before, I'm a writer, so I'm all of those things. So you can probably tell that the term BAME for me doesn't tell my full story. And so I do take issue with that. I'll let you answer this very complex question, Addy, and introduce yourself.
Hi, thank you. My name's Dr. Addy Adelaine. I'm CEO of the non-profit organisation Ladders for Action. And what we do in Ladders for Action is really, it's all about connecting knowledge and action. So a lot of the work that I've been doing recently is about these kind of practical problems, such as how do you define individuals, particularly in the research process, and what does that mean in reality? How does that affect kind of politics, governance, and all of those other things which research feeds into? So like you, I don't actually identify with the term BAME, but I recognize it's a way that many individuals choose to define me. And one of the things that I would say is that my identity very much varies depending on where I am in the world and my context. So I'm just going to switch to a slide. If you're actually watching this, you can switch your view to speaker view and it might help you to see this a little bit better. But you can switch back to gallery view later on if you'd like to see us all. So my identity, how I prefer to choose to identify, is I'm really proud of the fact that I'm a doctor, that I'm an academic, that I have a PhD. I like the fact that the term doctor is gender neutral. So I actually chose to get rid of my name that I was born with. So I was born Adelaine Williams, and I decided to get rid of the Williams part of my name. And I chose the name Addy Adelaine. So I'm really proud of the fact that I had the title that I earned and the name which I chose. I define myself as a scholar activist. For me, it's all about joining knowledge and action. I'm a woman. I identify as mixed heritage, not mixed race. I identify as Black with a capital B. I also regard myself as African, of African heritage and Caribbean heritage, not West Indian heritage. I am quite often defined as being second generation Windrush. My dad came from Jamaica in 1957, not on the ship Windrush, but as part of that generation. But I'm also, probably the thing that defined me more in earlier stages of my life is that I grew up in a very working class area, from poverty and deprivation. I also have been defined by the fact that I'm neurodivergent. So at one point that was something I was very ashamed of, and now it's something that I'm very proud of. So there's so many kind of facets of my identity, and I have had to think about my identity a lot, particularly as somebody that, like you, has lived internationally, has lived in Africa, has lived and worked in America. How I often don't get the choice to define myself, and I have to work around all these complexities. So like you, that was a very complicated introduction to who I am. But it's an identity that really can't be captured with BAME. Okay.
I think as well, we've touched on the fact that the way we define ourselves or identify depends on context. And I think of identity often as being, in some ways, a performance. And so, for example, I'm performing the identity now of this kind of academic participating in this conversation. But I also use the fact that I'm an immigrant. I use that identity quite strongly in my writing career to my benefit. But the terms that we use to define people, I think we can enter such complex discussions, because if you have lived in different countries, you will have been called different things. And so I think the discussion about the term BAME is such a specific discussion for this geographical situation that we're in. Yeah. But we'll without doubt draw on other socio-historic stories and context in this discussion as well.
I think also once you have travelled for a little bit, you realise how specific the term BAME is to the United Kingdom. It's a term that's not utilised anywhere else in the world, it appears, not in the European, Central Europe, not in America, not in Africa. So in Africa, I've worked for about 7 years in Africa, and I know in Africa I'm regarded as white. They would never regard to me even as mixed, let alone as Black. But then when I'm with my sister was brought up in America, and I have cousins in New York and Philadelphia. And when I'm with them, they actually get quite offended if I don't identify as Black. You know, I get the response of, are you ashamed of who you are? Why don't you call yourself African? Why don't you call yourself Black? But I know in Africa, people would be very confused if I called myself African or Black. I feel probably most comfortable with the term mixed heritage, but I'm not ashamed of my African heritage, and I'm not ashamed of my Black identity. It's not something that I'm trying to hide from or don't want to embrace, but I also want to be respectful of other people's lived experience. And I recognize that I'm very fair-skinned and I don't have the same lived experience as darker-skinned women, for example, and I don't want to claim a space or claim an experience that isn't my own.
I think that level of sensitivity and level of empathy that you're expressing, Addy, is something that comes from experience. And I think if you are coming from a heritage where you might be asked quite often, where are you from? As I am in my place of work. You develop this kind of language and discourse of answering that question and asking yourself a lot of questions that probably a lot of the population don't ever have to think about. But you mentioned something about BAME being very specific about the UK, and I think that's actually a really salient point, because unlike countries that are quite close to the UK, like France and Germany, these countries, for different socio-historic reasons, don't collect data based on ethnic or racial heritage. So that kind of demographic data collection is viewed quite sensitively in France and Germany. I think in France, the state considers itself colorblind, and in Germany, the idea of race, Rasse, is still seen as a biological construct and dealt very sensitively. So in this country, in the UK, there is a lot of data collected, at least in the last 15 years, on race. And from this data, you can build up some kind of picture on the lived experiences of minority groups, or even some inequalities in the system. But we have to remember that this data collection, or the term that's used for data collection, has a specific function. But when it enters public discourse, when it's used to describe identity rather than data, I think that's when it comes a little bit unstuck. But it's very convenient. And so as a convenient term to refer to the different groups in a multicultural society like the UK, the term BAME suits, and it suits the media because it's short, it's succinct, it looks good in headlines, and when it's used in the media, it starts entering the public discourse, and it starts entering the way people speak to each other. And I think that's where there's been some disconnect.
I think kind of if you look back, so we could maybe talk a little bit in a moment about how we got to the term BAME, but I think you're right. It's a convenient term. It's become a shorthand term, and we all kind of know it means generally people that aren't white, that aren't the sociological normal. And I think that's, to me, why the term is so problematic, because it's a form of othering. If we kind of go back to how race was constructed in the first place, it was to identify the other. It was to kind of, there's like this unspoken norm, isn't there, about what is normal. And there's a exercise I remember kind of where 3 individuals are asked to look in a mirror and asked to describe who they see. So a black woman looks in the mirror and says, I see a black woman. A white woman looks in the mirror and says, I see a woman. And a white man looks in the mirror and says, I see me. Now, it's the privilege to not see your identity. You know, if you don't face discrimination, if you are not othered by society, then you have the privilege of defining yourself by your interests, by your hobbies, etc., you know. And I think white people get very offended by being asked to define or being defined as white sometimes. Yeah, if you're not white, we all grow up trying to work out what labels are appropriate for us and where we fit in. So
absolutely, I was being deliberately facetious at the beginning. I'd identify as an overthinker because I know that the way I present myself, people will probably identify me in different ways. But this idea of being othered, I completely agree with you, because I think, first of all, it has to be said that there's something innately pejorative about using an acronym to describe people, BAME. So, you know, for example, I was thinking about this, and I was thinking, what other acronyms could we use? You know, sort of, SUMIX for suburban middle class, or, you know, YWOX for white working class. It just doesn't sound right. So there's a shorthandedness which is inappropriate to describe people with an acronym. But I think as well, the term BAME has now become so used in the media, and it's often used to talk about, you know, to talk or to bring to light inequalities in society. So I don't know, Denise, if it's possible to share the screen. Earlier in the month, over the space of 4 days, from the 9th to the 13th of October, I just did a search of how the term BAME was used in the media. And these are some of the hits. These are most of the hits that I found. So you'll see that I've taken headlines from a variety of media outlets, the BBC, Sky News, there's print journalism as well. And these headlines will probably look very familiar to all of us. These are the type of headlines that we're always bombarded with. And so the term BAME enters our consciousness. But if you look very carefully at the headlines, there are a couple of things that can be highlighted. First, there is often the idea of some kind of negation. So there is a story about a BAME in a negative way. And so it perpetuates this narrative of deficit related to this group BAME. And then there's also, in some quarters, such as the Daily Mail headline on the bottom right, there's a story of the BAME people being overrepresented. So this group is being taken care of too much. But actually, if you looked carefully at the article, in this case, and the article about the pay gaps, all of these newspaper articles, when you go beyond the headlines, break down the term BAME, and they say, okay, COVID hits the BAME groups, but it's actually mostly Black Britons and Pakistani origin Britons, and BAME workers earn less than 24% less than white people, but actually Chinese, Indian, and mixed heritage people earn more than white people in London. So we can stop sharing. Thanks to them. But
one of the things I was just going to say, one of the things that I noticed on one of those points there was it says BAME individuals earn less than white individuals. Now, the term BAME, it actually includes white minority ethnic groups. So that's one of the problematic, unlike in America, where they actually, and that's because of their own Pacific history. In America, they define more by color, or, you know, they have this history of segregation and the one-drop rule and the Jim Crow laws, etc., which we have a different history in the United Kingdom. Our history has been more around, has been more informed by different events that have happened. So, for example, you know, the minority ethnic and inclusion of white, Irish and Catholic, you know, groups was very much informed by the Northern Ireland conflict, etc. You know, that's why it emerged in our law and in our Pacific history, which was different to American history. But can you see in that kind of quote, it's really interesting that even though technically in the United Kingdom, white ethnic groups are included in BAME, there's this obvious assumption that BAME reverts back to meaning not white, because they've compared BAME individuals with white individuals.
I think there is not enough understanding of the term. There's not enough understanding of the term because it's been lifted off census forms and medical forms, and it's entered public discourse. And it's become a shorthand for a group which is not white people. So you're exactly right, Addy, that it should include, you know, white Irish and other white ethnic minority groups.
Can I actually interject here? Sorry. Because just to get the audience in participating in this discussion as well, if people could go to menti.com and type in the code 281077 and actually answer the question, what does the term BAME mean? Just to get a view of what everybody is thinking what the term means.
Okay. Should I go back? I was just going to show, I've got a slide here, which actually, I'm not sure if everybody is aware that the term BAME partly emerged because of its relation to the census. So I was just going to show you the census data a little bit here. Sorry, if you go back, turn the screen share off, if that's, oh, sorry, I was just about to show that slide. Is that okay, Denise?
Yeah,
just show that quickly. So on the slide that I'm showing, you can see that how this term BAME came about, and it was informed by the census. So it's this really weird mix of race, ethnicity, nationality. Logically, it makes no sense. And one of the things that I find really interesting about it is it breaks down, you know, the B in BAME represents Black, which is a racial category, but then later on it mentions ethnic minorities, but then it also defines Asia, which is a geographic location, not even a country. It's not an ethnic group. But when you look at the census, I find it really interesting that you can be kind of white Irish, but you can't be Black Irish, you can't be Black Scottish. And there's these inherent assumptions of what we are and where we come from, you know, and this census information bled into the public sectors. And then that's how it kind of became part of our colloquialism. But I've been working with the NHS a lot recently. So you mentioned earlier on, Sheena, that it was useful for data gathering. Even the NHS, it uses different ways of collecting data. So the staff survey, for example, will kind of highlight all the racial groups that are shown in the census, whereas the workforce race equality standard looks specifically at non-white individuals. So it does not include white minority groups, unlike the census data or the staff survey data that does. So even in like our biggest national institute, there's this kind of inconsistency with terminology, because I think at the end of the day, the terminology of BAME, it just is illogical. It doesn't make any sense to anybody. So we're all trying to kind of find our way around it in practicalities.
I was listening the other day to a talk that by David Olusoga, who is a well-known TV historian, as many of you will know, and also teaches at the University of Manchester. And he said something. He said, I have a very dark view of the future, and he apologized for this, but he said, whenever you have a term that is, you know, or a phrase that's supposed to empower, so for example, Black Lives Matter, it's supposed to be empowering, it can be taken and manipulated and used against you. And I think your example here, Addy, when you showed that the term BAME includes white Irish, for example, you know, or white traveller people, you're taking away from the fact that they might suffer inequalities, or they might require a specific look at, you know, workplace scenarios or even health scenarios, but you're taking away from looking at Black people,
yeah,
or Indian people, or people of mixed heritage, and so you're bundling people into one group because it will be more convenient, and to dilute maybe any specific issues that some groups will have. And in the same way, the Black Lives Matter movement has allowed us suddenly again to talk about Black rather than BAME, whereas I think for too long people have used the term BAME to talk about diversity when there isn't really diversity. So I think I was quite struck last year that the present government has a cabinet which is 17% BAME. But if you looked at that carefully, I think all the cabinet members that they're referring to are what you would call Asian. 3 of them are East African Indians, 3 of them are privately educated. It's not a representation of the issues that statement is trying to convey.
Yeah, and I think when it comes to research and higher education, it's quite significant as well. I was just wondering if I can show another slide quickly, Denise. Is that okay if you put me back?
Whilst you're talking about that, can we also talk about something that's come up a lot is that the term BAME could mean non-white and or non-British white as well.
Mm-hmm.
So I think people have that misconception that, like you said, Irish people are not included in the term BAME, but they are. And then also travellers or gypsy population are also included in the term BAME. And also as in non-white, but then you have European whites, white Australians, possibly white Americans as well. I'm not familiar with that one, but in the government websites, they do actually list white Australian and white European, Irish people, and gypsies and travellers as being included under the umbrella of the term BAME. I think that's quite interesting if you could just touch upon that as well. And my personal favourite, a lazy term at best, which another thing for you to think about is, are we missing the nuances with the term BAME? It's not really encapsulating. When you say Black, you're not really talking about what that means. Black Caribbean, Black African in Africa, and in the Caribbean, you've got so many different heritages, nationalities in there. So that's also something that's not captured. And when we speak of Asia, Asia also doesn't just include India and Pakistan, but also includes Cambodia and Laos and South Korea and China. So if we can basically deconstruct what BAME actually means, and how does that actually perpetuate the inequalities in how we're reporting, whether it's in health or it's in economic landscape. What is it that we're doing when we are using the term BAME and clumping everybody together? Like you said, the othering of people, because the non-white, really it's like white British, but Britain consists of Ireland, Northern Ireland, Scotland and Wales. So is it that? And like you said, like BAME is specific to the UK as well. So just get your thoughts on that as well, because is it possible that we are perpetuating inequalities when we're using the term BAME and not truly understanding the nuances?
So for me, I think there's a couple of things on that. If you could just turn the screen sharing off for a second. And I think there's a couple of things that are really significant to me. So I've seen some of the comments come in as you were speaking, Denise, and people are saying, you know, white Americans don't regard themselves as BAME, or, you know, there's two different ways. There's the technical history, which we can go into, or the common kind of usage of the term BAME. And, you know, there's two different ways of looking at that terminology. I think in colloquialism and everyday language, BAME generally means not white, not from around here. Technically, it doesn't mean that. So whether Americans choose to identify themselves as BAME or not, technically, they would be a minority ethnic group, you know, or could be considered as such. But you don't often get to choose the way that you're defined. I definitely don't. But, you know, often we are not using the way BAME in a way that is technically accurate, even though that technicality doesn't make sense. We're not even utilizing it in its technical way. I think the lack of nuance is something that reduces us and dehumanizes us. So we both started off with our introduction about our identity, and we all have this complex identity, but the process of bunging us all within one acronym and othering us is a process of dehumanization, and that kind of history is as old as the textbooks itself. This has been happening for a long time, labeling in order to dehumanize, make us less, othering us, making us less familiar to those who we're talking about. The other point I think it's really important to highlight was what Sheena was talking about earlier on, is how the term BAME masks anti-Black racism. So Sheena was talking about kind of the representation in government. So on that slide here, I'm kind of showing the proportion of full-time individuals in research. So I just thought it might be useful as we're speaking to a largely academic audience. Now, within this, you can see that 81% predominantly of people in full-time research positions in higher education are white. When you're looking at Black women and bringing that intersection of identity in, it's 1.3%. We have over 19,000 professors in the UK and only 35 Black women. Now, I've been doing a lot of work recently with UKRI and trying to get the data. So I know the general population of the UK has about 14 to 17% with what could be defined as BAME. But when you look at UKRI staff members, it's 7%. And when you look at funding, it's 9% are BAME. Within that, my suspicion is that most funding of BAME individuals goes to Asian or East Asian individuals. My suspicion is that the number of Black researchers to obtain funding is minute, but I can't even get the data because it's not disaggregated beyond BAME. There's no way of finding what the proportion is. And quite often when the numbers are so small, you can't even do a freedom of information request. So that BAME title is really problematic in that it hides anti-Blackness. And I said earlier on, I do define myself as Black, but I try to be careful in that definition and the context that I'm defining myself, because I'm aware that I'm a very light-skinned Black woman and that there is massive colorism and anti-Black racism, that even with me claiming the title of Black or of African heritage, I might be masking the true discrimination that darker skinned academics face than myself.
I think, Addy, you're showing what I mentioned. David Olusoga had that very dark view, and we've seen how a term which might have emanated from a genuine desire to find out what the lived experiences are of people living in the country on the census can be manipulated. And without doubt, I think the category of BAME and the quantifying of BAME academics, BAME students, obscures, you know, probably real problems, and the real problems could be the lack of Black lecturers and Black professors. I think it might be SOAS or one of the London universities started the campaign, "Why is my professor white?" in the history department. But going back to the term BAME, just so that we can completely disenfranchise it. The idea of BAME and this idea of Black, Asian, I think it doesn't take into account also the type of multicultural country that Britain is. That is, it's a country of migration, and it's a country of emigration and immigration for centuries. So if you consider colonialism and empire as a type of emigration, you can see what I mean. But just looking at more recent times and more modern times, some researchers, Devyani Sharma, has written about the fact that we have to acknowledge that there have been several waves of migration. So, for example, more recent waves of migration could have been, to fall into the category of Black, could have been from countries in Africa, such as Sudan, Somalia, whereas earlier migration from African countries could have been from Nigeria, Ghana, and Zambia, Zimbabwe. And similarly, if you look at the A in Asian, post-war migration from the subcontinent emanated from certain parts of India and Pakistan, and more recent migration from the subcontinent has come from different parts. So these terms are not taking into account that these groups themselves, that everyone finds difficulty in labeling, these groups themselves are changing. And these groups themselves might identify quite differently. The more recent migrants might have a stronger affiliation from the homeland because of more ease of air travel, so they could have more visits back home. And also the technology might allow them to communicate more with people from home and in their heritage languages than earlier migrants. So really, people who assume that this group, BAME, because it sits aside from the main group, the normative group of white, as a homogenous group of people, it's quite useful maybe to look at us as a homogenous group of people, but it doesn't tell the story. And if society should reflect the population that live in a country or in a nation, then more subtleties and more acknowledgement from within the BAME community itself needs to take place. So, yeah, Addy.
I was just about to say, I think we really need to push back against that denial of nuance and complexity. You know, as humans, we want to label and put each other in boxes. And I think some people would say, you know, identity politics is confrontation. I've got issues with that kind of statement anyway, but, you know, there is a claim that identity politics, that labeling ourselves like in our different subgroups as Asian or Black or mixed heritage is divisive, okay? But I would actually go with what Bell Hooks says, and she says, you know, we find solidarity through the recognition of difference. So actually the conflict is created when we don't recognize that we don't have identical experiences. It's not about a hierarchy or who's experiencing the worst discrimination or who did what or to whom, but we have to recognize that our lived experiences are different, and through that recognition of difference we find solidarity. So it's the nuance that actually brings us together. You know, it doesn't divide us.
I think in the 1980s, Paul Gilroy famously, wrote a book, Ain't No Black in the Union Jack, and he was arguing for the power of the master signifier black, and arguing against exactly what we're talking about now, this nuance and subtlety. He was saying it will take away the power of the signifier. But I think, unfortunately, things have moved on from the 1980s, and I think division has been sown already. But it's this acknowledgement of differences from within the BAME community. That is, a middle-class Asian, Oxford-educated person has to acknowledge that their lived experience is very different from a kid who comes from a different background. And to, I think, go along with this idea that we're all in this together, to use that phrase, in this group, I think is.
I think it's funny that we've obviously thought about this a lot more than your average Joe has, because we experience discrimination and recognize the importance of difference. We're forced into this reflection of our identity. So there's some comments coming in, I can see, saying that there's no such thing as BAME community. And I think I even have slipped into saying BAME community. I agree. If I use the term BAME, I will say BAME communities, maybe if I have to, but I agree with it. There's no such thing. Or that mixed heritage people aren't all from Africa and, you know, the Caribbean and white, etc. So, you know, I think we have to kind of recognize that difference and that nuance, and it helps us identify what is similar. It helps us be allies to each other, you know, by, you know, there's been great movements in disability rights movements, LGBT, you know, gay rights movements, etc., by working with identity, by recognizing the lived experience of gay individuals or of women or of disabled individuals is not the same as other individuals. And that actually to address the discrimination and the challenges that they face in their life, we have to recognize and embrace that difference. So why does it become so confrontational when we're talking about race?
I think it becomes a confrontation when people who might occupy a privileged position feel challenged, feel that position might, you know, sort of be challenged by these kind of discussions. But going back to something else that you said, Addy, I mean, we do seem to live in a race-obsessed society, and I think I recently watched a documentary where it was revealed that the Romans, for whatever their flaws, were not racist. So Roman emperors, there are Roman emperors who probably came from North Africa or different parts of Africa, and we don't know whether they were black, or because the Romans weren't interested in that. Well, we don't live in that kind of society. And I think we have to acknowledge that race plays a part. That if you're black, you will be subjected to things that myself as an Indian woman won't be. And like you said, that there's a spectrum of difference. There's a spectrum of being black. There's a spectrum of being Indian. I think there's also an intersection as well with class and gender. So identity is extremely complicated, but I think possibly a starting point, if we want to be looking forward and looking to some kind of positivity, it could be that we just all have to develop a sense of when a certain facet of your identity is important, or when it plays a part with your identity. So just to use an example, two women, Nadia Hussein and Mishal Hussein, I've just chosen them because they both have the same surname. But Nadia Hussain famously won the British Bake Off, Great British Bake Off, and is now a television presenter. And she uses to great effect the narrative of her life, of being the child of immigrants from Bangladesh, of being from quite a working class background. And possibly Nadia, can use the idea that she's British Bangladeshi to her advantage. Whereas Michelle Hussain, who is a television journalist for the BBC and works on what should be an impartial current affairs program, the Today program, perhaps her ethnicity is not a context that we need to consider, is not a facet that we need to consider in that context of being a journalist. Is that too complicated? Do you think that could ever happen? Because like I've shown you with those headlines, the term BAME is very convenient for short, sharp headlines, and that kind of works for a lot of media outlets and conversations.
Yeah. I'm not sure. Yeah. I think the general theme is that we need to kind of have this complexity, whether it's in reporting or not, and kind of those unspoken terms. I'm just kind of keeping an eye as well on what's coming in on the chat. So I think it's really hard. You're not born with this understanding of this complexity and of other people's identities, etc. I know personally I've been on a real learning journey. I don't even like saying the word that I defined myself by as a child. Half caste was the term that my family used, that everybody used to define me. I don't even like uttering it now, and our history was taught in such a simplistic way. And also, my father was Jamaican, and he had been taught his history within a colonial kind of empire too. So he even was filtering down this kind of British colonialism and this oversimplicity of our history. And it was only kind of later on that I learned about the complexity of Jamaican history, of the fact that there was indigenous Jamaicans and Indians and Chinese people, and that mixing had been going on for generations. It was only later that I learned about the great civilizations of Africa and the library at Timbuktu and the great empires, etc. But there's this constant kind of reduction of who we are, and it's almost like you can feel that reduction is an attempt to reduce you and your importance and your significance as a human being.
I think that the idea of education, the idea of what is taught in schools, how it's taught, when it's taught, I said this so many times before that I think the creative industries have been left to take up a lot of the storytelling of Britain's history, and that itself is problematic, because storytelling naturally doesn't always consider all perspectives. Yeah. So the stories of of the romantic view of the Raj, for example, that can be portrayed in books and films. But significantly, I think children growing up in the UK may never learn about British colonization. Whereas if you look around the country today, there's a there should be a neon sign flashing. We are where we are because of what we were, and we have come here because of what's happened. Yeah. And it could be a positive story. It could be that the language, for example, the English language is so global. It's used now as a lingua franca in countries where there's conflict between in the indigenous populations. So it's used as a lingua franca, for example, in India, because people would rather learn English than the language of a person from a different state in India. It's used as a lingua franca in countries.
I guess I kind of feel about language a little bit differently, because our histories are slightly different. So I think when we go back to the construction of race first entered into British law with white identity. So I think it was in Barbados and in colonial in plantations, etc., and in slave plantations. And countries that kind of experienced that, they brought in under colonial law this idea of white identity, and it was brought in to protect white individuals from what we call chattel slavery. So the idea of race was first brought into law in order to protect white individuals, and that still is echoed in our laws today, and the construction of the Equalities Act, etc., harps back to that. It was also kind of the idea of race was brought in to justify why slavery happened. And your point on language, you know, my ancestors were brought from Africa to the Caribbean, and we weren't allowed to speak our indigenous languages. We were forbade from telling our history, from speaking our languages. And that, to a certain extent, is why Black kind of created itself as an identity, because Africa is not a country. It's a huge continent with very diverse cultures and ethnicities and ethnic groups. Yet I personally don't know where in Africa my ancestors came from. It's probably Ghana. It's probably Nigeria. I don't know what language they would have spoken originally, etc. So we had that, you know, it wasn't this passive kind of thing. It was history denied purposefully from us, you know, language denied purposely from us. And this term BAME, the B in BAME, is a purposeful creation, you know, and also the minority ethnic thing. When we're looking at this term minority ethnic, often we're not actually talking about ethnic groups. So in India, I don't know how many ethnic groups there are, hundreds. You know, that is an ethnic group. I think Uganda has 157 ethnic groups. But when we talk about minority ethnic, we're quite often talking about a country. And again, that goes back to the scramble for Africa and colonialisation, and how Britain was one of many colonial countries that actually created borders and this idea that kind of misplaced ethnicity with nationality, and it wasn't our nationality. So this whole story has led to a corruption of terminology and language, and it's playing out today.
Can I ask then, is the term BAME a form of neocolonialism? Because some do say that we are in an age of neocolonialism, and it's just with COVID, it's now the blanket has been lifted.
I think a term doesn't have, you know, I think policies enact colonialism or inequality, not the term, but it could be, from going back to what I said right at the beginning, it's the way that a term that has been devised for one reason is used in other ways. The way that it's entered public discourse means that whenever we use the term BAME, we're indexing. You know, language is never used in isolation, so we're always thinking about where we've seen it, how it's been used. And so we're indexing all those, for example, those headlines over the 4 days, we're indexing that idea of negation or of deficit, of a problem. And so it might be, I'm not sure if I'm really answering your question, Denise, but it might be that the term is lending itself to perpetuating this idea of these others in the country being a problem.
I guess for me, it's really hard. I have a little bit of a problem with the idea of neocolonialism. So neocolonialism, for me, is a theory, a way of understanding our current context through a lens and appreciation of what colonialism was and what it did and how it manifested. So I guess I've got a little bit of an issue with that perspective, because it never really stopped. There was, you know, if we're not being affected by colonialism today, you know, which many people would argue, you know, it was hundreds of years ago, we're not being affected by today, then great, tell me the day that it stopped. It's been a progression. It's, you know, been a blurring into the current day. If you look at even our NHS and how it's constructed, it's informed by our colonial past. The reason why we have more Bangladeshi and Pakistani doctors is because in those countries under British colonial rule, they trained more local individuals as doctors. whereas in the West Indies, Black women weren't allowed to be trained as doctors. They were only allowed to be nursing sisters or midwives. Now look at the NHS today and look at what the manifestation of identities is across professions. So these echoes are still resonating, you know, through. There wasn't a pattern of this happening and then it stopped on the 25th of December 1957, and then we started with an exact replica of what went the day before. There was no line where, or division where it stopped. So I think there's a growing interest in neocolonialism because people want to analyze the present day with this understanding of our past. But at the same time, this isn't new. I think we also have to, and Sheena's been really good at recognizing the scholars that have gone before us, that have been, you know, constantly critiquing and criticizing and reflecting, and Paul Gilroy and Frantz Fanon and Dubois. There's been so many of them, and there's this, and also African authors that often don't get cited or referenced. So whilst the mainstream might be picking up on this term of neocolonization more and analysing the term BAME more because it's what's trendy at the moment, that critical reflection to where we are with colonization has been ongoing for hundreds of years. And there's this huge kind of genre and plethora of studies and research and work that kind of identify that. So I think we need to stop acting like we're starting at ground zero on this reflection. There's so much we can learn from. I don't think it will give us, and I think Sheena said as well, it perhaps isn't right for our day and time now. We have to continually develop and adapt these theories and ideas, but we don't need to start from a beginning, from a ground zero, because there's been so many brilliant authors, scholars, minds that have gone before us that we can draw from and learn from.
So opening the floor up to the audience a bit, we have a lot of really interesting conversations that have come in the Q&A. I'm going to try and lump a few together and address them. So one of it is around the structural use of the term BAME. So this is, you know, something that we could potentially work on ourselves as individuals when referring to people, but when it comes to larger structures, so somebody mentioned the WHO surveys, for use within the NHS, and because we're a public health institute, so we're collecting data within this framework and then applying that to our healthcare systems, to our research papers. They use this terminology. So what are your thoughts on how we can shift away from that to something where the data is more disaggregated and reflects these nuances a bit better that you've been discussing?
Sheena, did you want to be in, or?
You'll probably have more information to share, Addy, but maybe the first place I would start is, maybe we should stop thinking that it's a really big deal. Maybe we should stop thinking that it's very difficult to disaggregate, like you said. You know, why do we need to use a one-size-fits-all approach? Why don't we just discuss or find out data that's relevant to the context? So why don't we find out exactly how many Black lecturers there are in British universities and how many Black professors? Why don't we find out how many people of British Indian or British Indian origin suffer more from COVID? It could be that I think one of the comments in the chat or in the Mentimeter talked about being lazy. I think that's too generous, actually. I think it's an obfuscation. It's obscuring something in the guise of it being too complicated to do otherwise. But I think we should just stop lumping things and just be a little bit more complex.
I agree with you. I think at the moment there's a bit of a trend of anti-intellectualism and anti-academia. And I think maybe part of the reason why people say it's too complicated is because they don't really understand research or research methodologies. I think it's really important that we do look at larger subsets so we can identify patterns of discrimination, like the fact that 5 times more Black women die in childbirth in the United Kingdom today. We have to identify, but Black is quite a huge category, and people who might be defined as Black might also choose to personally identify in other ways, as Ugandan, as South African, as Black British, as Black Irish, as Black Scottish. So they can identify in that way, but at some level, we still have to look for those big meta patterns. And maybe we do want to, in some cases, we need to look at everybody who's not white. Yeah, in some cases, and in some cases it's not relevant. And in some cases we need to really narrow down. So I think with the technology that we have at the moment, it's not research 20 years ago. We have the technology that can group and subgroup quite easily. It's not a huge amount of work, you know? So why not let people define themselves in multiple different ways? And then, but what that would require is a better understanding of research, how research works, what generalizability is, why is it important, etc. You know, when it comes to COVID, we've identified that 4 times as many Black individuals are dying than, I think I don't know the data for South Asian individuals, but I think it's even higher than Black. And particularly within healthcare professions, most doctors that have died have been Asian individuals. So, you know, there is a need to understand this pattern, but race is not a genetic construct, it's a social construct. So where we see patterns going across, we need to know how those constructs were made, how these ideas were made, so then we can work out how these patterns emerge. I think there's a bit of a mistake at the moment that people are confusing race as a social construct with a biological construct and looking for genetic differences within us that has caused a discrepancy in our deaths to COVID. Whereas I personally believe COVID deaths are more related to social factors, to deprivation, inequality, poverty, discrimination, rather than the amount of melanin that individuals have in their skin.
And I think similarly to, you know, previous discussions, after you have that headline grabbing comment, you go further into a discussion, and people have, I think research has unearthed that it's probably very connected to socio-demographic, where people live, deprivation, all these aspects. But I think Addy makes an excellent point that we mustn't pretend that this stuff is hard to do. You know, research and technology and data gathering and questions, the types of questions you ask people, the way people are surveyed, research is lauded in the UK. Our research facilities and our universities are, you know, world beating, shall we use the term. I use that facetiously,
yeah.
But I think Addy makes a very good point that we can do this, and we shouldn't forget that our technologies have improved.
I think we need to demystify the process a little bit, because people just kind of almost panic and it's so complicated, and actually we need, if people understood it better, we could break it down better. And I think
it could even come down to something, sorry Addy to talk over, but it could even come down to something as simple as the question that you ask someone. So the way you frame a question could influence what that person who is being asked a question imagines the answer should be, what kind of data you're trying to gather, how that will affect them. Will it be a negative or a positive effect?
Exactly. And I think actually this is one argument why we need more Black and BAME researchers, because, you know, from the data I showed you earlier on, the majority of researchers in the United Kingdom are white. The stats are lower than even in the United States with academics. So actually having individuals who understand the importance of how questions are asked and how the nuance manifests is really significant. And if you don't have that lived experience, it's really difficult to understand the importance of that nuance and complexity of identity. It's not impossible. I'm not saying that no white people should do research on race, but it does help to have people with lived experience who know how to frame questions. And at the moment, the government's been saying quite regularly, oh, you know, we're following the scientific advice, we're listening to science, like there's one science done by one group, etc. And again, we need to stop holding this kind of mythical science and mythical research up like it's something that can't be explored, criticized or touched.
I just wanted to pick up on Addy's point about the researchers, because just from, you know, sort of my own experience, even from a very well-meaning point, it can have quite an impact. So one example is in the field of multilingualism, there are actually not many researchers who come from these minority ethnic backgrounds. And because researchers want to show that even though the UK might be a monolingual state, it's a very multilingual society. There are a lot of heritage languages, community languages, there are many terms for these. They're quite active in the country. These researchers tend to focus their research in areas where these languages are very alive. And so the tendency has been in linguistics research for a lot of the research into minority ethnic communities to be conducted in areas where they live in very large groups, in very close communities. They have community schools, they might even have faith schools. So what has happened is in academia, it's perpetuated an idea of what, for example, a British Asian looks like in the UK. And they have a discourse, a very strong discourse of what this British Asian behaves like and thinks, you know, the communities look like. So from a very well-meaning point of view, this shows that, you know, research has got an impact on how even in the public, the discourse will be affected, because often media report on academic research. When I did my research, I was one of the few researchers who looked at middle-class, higher professional, second-generation South Asians. They were they were forgotten, or they got under the radar in terms of research.
So I probably might raise here so one of the things I've been talking about a lot recently is the COVID, £4.3 million that went to research on COVID and BAME communities. From that, £0 went to Black academics. And one individual who sat on the assessment panel was actually co-investigator of 3 of the 6 successful awards. So there was this bias within it. So there was no Black individuals in it. Looking at the response. So before I engaged in this, I was actually working with the NHS and looking at discrimination and structural and systemic issues within the NHS. Now, you can't understand the lived experience of staff in the NHS without disaggregating BAME, because the experience of Asian staff, of Black staff, of white European staff is different. And I'm not saying worse, I'm not trying to get into a hierarchical argument, but the discrimination that a white Romanian staff member faces might be very different than a Muslim Black woman faces. And the reasons why this matters, so for example, is in the COVID response, there was reports coming forward that staff had unfair access to PPE, that some were fearful of speaking up or being disciplined for speaking up. Now, you need very tailored responses to address that inequality and that discrimination. BAME won't cut it, because the same response is not relevant to all individuals. All of these issues need to be addressed, but you need to look at what's really happening. So when you don't get research that really kind of narrows down this response, it has life and death impacts on our communities, because it means that the research itself is not nuanced enough to respond to the practical issues that are being faced. So I know like this conversation might seem very theoretical or idealistic, but we always have to remember that research, you know, knowledge is power. Research affects policy, policy affects our life. And particularly during the COVID crisis that we're experiencing now, this has life and death consequences. So when no Black researchers get any funding, when the issues that are highlighted in the Public Health England report aren't addressed or researched, then we have a genuine issue. So that's when this, you know, theoretical debate about whether we like the term BAME or not becomes serious, you know, because we are playing with people's lives here.
Can I ask one of the questions posed from the audience? This is from Leoba. She says, thanks for these insights. They're really helpful and it's great to listen to this discussion. I'd love to know the speaker's views on how we can get institutions, LSHTM in this instance, to embrace this complexity and abandon BAME in their official language / encourage researchers, especially in health science, to move beyond BAME in how we conduct researchers. And I also want to add on to this, how do we effectively implement interventions and policies whilst trying to understand the notion of BAME? Is it possible to do it in this current state that we're in?
Okay. Again, Sheena,
Addy, you go ahead
okay.
first.
So I would say, in regards to how do we get LSHTM to change, so I like to think of systems and complexity, and we tend to think of these big organizations that are kind of almost monolithic and unmovable and unchangeable because they're so big. And, you know, LSHTM is a big organization, but organizations are made up of people and individuals. And most of the people that are listening to this are part of that monolith, a part of that kind of structure and organization. So how do you change the organization? You change yourself. You do what you can when you can, and you are continually reflexive of that process. So when you do your own research, if you haven't got somebody telling you to use the term BAME, don't do it. Reflexive on this, speak to your research participants, ask them how they would like to be defined. So there's something about disrupting the power where you can, and speaking to, actually, for me, I believe that you always need to speak in the research process to your participants, to the individuals who will be affected by your research. They should be part of your research design. They should be part of the delivery, and you should always feed back to the communities that you seek to do research about. So for me, that's good practice, but I know it often doesn't happen too, but to me, you have to feed back to the communities that are affected. So if you're working with even if you've applied for funding to look at BAME communities, then as part of your methodological design, you critically question that use of terminology. In your analysis, you break it down and break it into subgroups, and you look at it yourself. You're part of the organization. As researchers, you have a power and you have a duty, an ethical and moral obligation to critically analyze this and not just accept what you're told. And I think that we have to kind of constantly question and debate, which is this conversation is great for. And that kind of brings me to the second part of Denise's question. How do we challenge interventions and policies? It is really difficult at the moment. And I think we're at probably the most difficult point of my lifetime in regards to this subject area. I've never known anything like it since this summer, since the disproportionate impact of COVID. I can't even explain what this year has been, and it's made me question everything that I thought I knew. And we've seen more racial hostility, more far-right extremism, more denial of critical race theory and critical questioning. It's really, really challenging. So there's no quick answer to this, but I think, as an action researcher, what I do is identify a problem, explore a problem, take action, reflect, start again. And you constantly have to just be going through that cycle and changing and adapting and trying to improve. Just don't give up. I don't think that's my answer. Constantly reflect, constantly question yourself and evolve and challenge everybody around you to the best that you can, but also look after yourself. And I think that's another point that I often forget, because this is hard work and these are critical, challenging questions. We've both talked about how much we think about this and have questioned ourselves. Don't be hard on yourself either. Nobody gets this perfect. Nobody's got the right answers. So be forgiving and kind to yourself in the process.
I think Addy has given an excellent, brilliant answer, and quite given some very doable strategies. I love the idea of starting with yourself and just small changes and small actions. Addy's points on when you are a researcher, being in charge of your language. I think I can't add anything else to that. What I will say is that I'm not in a very, very high position at the University of Manchester. I'm a teaching fellow. But I have used this small platform that I have to try and enact change. So I wrote an article for the Conversation about the term BAME, and I think it came out about 3 years ago. I thought the article would change the world. I was surprised to hear that actually the world carried on regardless of my article in the BAME, article about BAME. But I'm not alone. There have been a lot of articles and blogs written about this term, even within the government, even within the civil service. One of the policymakers of the civil service has a blog, and she regularly posts on how she thinks this term BAME is not suitable. So there is sort of action happening, you know, within the ground. There are things happening. But this idea of doing something where you are, I love that idea of Addy's. One example is I sit on the EDI committee at the school that I work in the University of Manchester. And within that committee, I raise, when I have an opportunity, the fact that the term BAME, which we see everywhere over university, isn't sufficiently acknowledging the complexities that I think a university should. In class as well, I ran a module on a master's in intercultural communication, and I encourage the students to have a conversation about how we will talk about each other. So what are students comfortable with being identified as? It's a module that attracts a lot of students of minority ethnic background, British and international students. So giving us the power to decide how we will be referred to. And actually the conversations in that class have been very illuminating, that students have said, I've been approached by admissions to talk about being a BAME student, but actually, or being an international student even, whereas I'm actually British Chinese. So institutions have to be taken into account by the people who occupy them, so students and lecturers alike.
I think you make a really interesting point there, because this is a very theoretical argument, and I think, you know, as academics we tend to get lost in conversations like this, and what you've just demonstrated is about, for me, I'm obsessed with this, as you probably get, joining knowledge and action. What you did there was joined a theoretical debate with the lived experience of your students. You brought it back to reality. And I think we have to not get lost in the debate and the argument, and remember why this matters. You know, this matters because of the research we do and the effects it has in our life. This matters because our students, when they're labeled as BAME, they feel othered in the university, like a just not white homogenous group. And, you know, for me, I've had to learn my history and my heritage, and it's something that I'm so proud of, and I love my heritage. And having that acknowledged makes me feel more included, more valued as a human being. It rehumanizes me. And that's why this matters. It's not just a technicality. This has a real impact on your student's life, on your research. This is real. So I would say always bring it back to action and reality.
Absolutely.
So we're moving towards the end of the session. This has been really great. There's an audience question that's been upvoted that I'd like to ask you guys, and it's looking for a bit of advice, so possibly a very good place to end. So it's from Anna, who is a Black American woman who's dropped the term African American when she's come to the UK because it's not commonly used, and suddenly found herself referred to as BAME. And when that term's rejected, the question she gets is, well, what do we use instead? So she wants to know, what do you say to people who still feel the need to categorize people by BAME or by externally imposed racial terminology? What can you do in those circumstances?
I'll start if I may, Addy. I don't like confrontation over my ethnicity. I feel very uncomfortable actually when people say, do you mind if I call you Asian because you are Asian, or where are you from? I actually, even though we've spent probably an hour and a half talking about this stuff, I've written about this stuff, I've researched identity, I still find it really uncomfortable to talk about myself and identify as in a way that will please the person I'm speaking to. I'm not the best person to give advice for this. And maybe I showed that right at the beginning when I said I identify as an overthinker. That doesn't mean that I don't feel a very strong pull towards my Indian identity. I definitely do. And as a writer, I have definitely sort of plowed that field of identity, of being Indian, of being the Indian diaspora. But I don't have an easy answer. Maybe we should change the question and ask the question of why does that person want you to specify a label or a term? Why is that so important to the person you're speaking to, that they find a way that they can define you? I mean, it's quite nice of them to ask you, but I would turn that question around. Addy?
No, I would just really echo what that you say. I think if you haven't watched it before, there's a little comedy skit, Where Are You From? It's like a BBC little free, the Where Are You From game. You should look at that. But yeah, that question, because you have to like judge what they're really asking. Are they asking like which university, what organization, which bit of the country, whether I'm mixed heritage, you know, whether I'm British, etc., etc., etc. It's so tricky. And I think part of the reality is that whilst we are moving to a point where I think an increasing amount of people have a shared desire for us to embrace the nuance of our identities and to allow people to have the choice to identify, the reality is that we're in this moment now. And BAME, often we don't get the choice to choose how we identify. So I think in response to the individual's questions, I would really need to know the context and the person who is speaking. If it's significant that they understand the nuance, like in their research and their work, I would sit there and have a long conversation about the complexity of my identity. If they are in a position of power and have lots of research funding that they want to give to BAME individuals, I would just go, BAME. And then I would, in my research, break down that nuance. I think
it's funny because sometimes a secondary question. So I have 2 kids and they are mixed heritage, and kids at their school ask them, where is your mom from? Where is she from? And one of my daughters, my older daughter, came back and she said, well, I told them that you're British Indian, mum, and that you're British of Indian origin. And I was like, hang on. When did you ever get the impression that I would first off say that I'm British Indian? And I don't know how the story will end, because I think we're still developing an answer to this in
and
my
I think
family.
also it's about not having, we are, the whole point of this is to identify we are human beings with complex, nuanced, intersectional identities that cannot be reduced to the monolith of BAME. And I think, you know, as individuals who feel stuff and emotions and who have family, etc., it's not constantly our responsibility to educate people. So, you know, I choose to identify myself how I choose to identify myself. Where I feel it's necessary for social good or for change, I will try to educate the person. But if it's just going to drain my energy and drag me into a 2-hour debate with somebody who is probably not going to change their mind anyway, then I don't owe anybody else that conversation. I don't owe them the emotional labor and the effort to try and explain to every single person on the planet. So I think to the person that asked that question is, you answer how you want to answer and how it suits you at the time, and don't feel obliged to give them the answer which you think they want. Like, this is not your responsibility.
Good answer, Addy.
And on this note, this is a question for both of you, Addy and Sheena, but also for everybody attending. Once again, with the menti.com, to finish things off, could you answer the question, where is it now? Is it time to ditch the term BAME? And if so, what do we use instead? And who comes up with that term? Just something to add on. Some of these answers so far have said we can use the term global majority, or nothing. Define yourself to your liking, depending on the situation. Somebody else has said, let's just use person instead. So others have said we should ditch the term BAME and use individual heritage to identify people. Everyone should be identified or referred to differently, e.g. Black, Asian, light-skinned, African, etc. BAME lazily hide individualized discrepancies.
I agree. I love the first comment in the blue, that the global majority, because it was always like, when did we become the minority? Mm-hmm. So we are global majority individuals, you know. So I really like that, and there is a term that sometimes I utilize, that occasionally I slip it into my writing as well, and I'll just refer to myself as a global majority individual.
I love that term. It's not something I've come across, but you're absolutely right. You know, that we're in the majority here in the world.
I think I would always try and ask people about their personal identities, and I think for me the time has come to stop using BAME wherever it is feasible to do so. I think there's a slight danger in this as researchers, because sometimes we need to see those wider patterns of discrimination. I feel if we disaggregate too much, we're going to, again, lose our ability to see the massive discrimination and anti-Black racism, etc., that we still have in the UK. So whilst I know where we want to get to, I think we can't jump to the end. Whilst there is discrimination that occurs on the basis of perceived identity, we still need to research that perceived identity, because it is still shaping people's lives and it is still causing discrimination. It is worth investigation. But I would also like to respect individuals' choice to choose. But I don't want to, I think sometimes this kind of colorblind racism approach, it came in like the 1980s of we don't see color, it's not important, I just see everybody the same. That's a utopia that we haven't reached yet. That's where I'd like to end up. But the reality is Black young people are 40 times more likely to be stopped by the police. Black women are 5 times more likely to die in childbirth. That we are more likely to be in virtually every category. There are life and death social inequalities based upon presumed identity. So whilst I might not like certain identities, if it is negatively affecting my life and marginalizing my life opportunities, then I think as academics, as researchers, we should be investigating those categories.
And I think what you've shown, Addy, is that the category, you know, Black is still doesn't include all the individual differences, and it doesn't tell the full story, but it tells enough away from a very one-size-fits-all term such as BAME. It tells enough about you mentioned earlier, the meta pattern for that situation or for that context. So I don't think, I think there are some people who actually might identify as BAME, so I wouldn't want to be taking away that identification from them. But I think if we've learned anything from this conversation, is that we don't have to use the same term in every single context or for every single discussion. We can use a variety of terms, and we can have, in the same way, a variety of identifications. And researchers should be able to feel confident enough to direct their language and their terminology to suit their research and the drive of their theories.
Thank you.
Okay. Well, thank you, both of you. We've just got a couple minutes left, so I have really appreciated listening to you the entire time. I felt like a bit like a bobblehead. I was kind of just nodding as you were talking the entire time. I mean, yeah, the insights you've brought and the discussions you've had together have been very, very welcome. I see in the chat that people are very grateful for you guys taking your time and your energy and your thoughts to share these ideas with us.
I've actually learned a lot. I really appreciate, you know, hearing from Addy and from you, Denise, and I haven't managed to keep a very close eye on the chat and the comments, but I've learned a lot from this discussion. So thank you to everybody.
Yeah, there's been some great comments coming in. You might have seen me kind of direct my view occasionally. I've been trying to watch. It would have been, yeah, I know some of the people that have actually joined today, so maybe we'll have our own conversations later on. And there's people actually in the chat who I have significantly learned from, like Jen Day. So yeah, there's people there that have been my teachers that are chatting away at the moment.
Yes, agreed. Please continue the conversation. I think this is the whole point of the time that we're in right now, is that we shouldn't stop talking just because this conversation, like us four, is finished.
Could I also say, can you tweet? I don't know if you've got a hashtag that you want to share, but my Twitter handle is Addy Adelaine, at Addy Adelaine. It's my name. But yeah, I think that Denise and all of the team at LSHTM should be getting credit for their work in this amazing event. So I'm going to say for them, please tweet and say how amazing and worthwhile this was, because I think they've done an outstanding job.
Well said, Addy. Congratulations, Denise and Naomi, for setting up the event.
This is largely a Denise event, so I was going to say thank you to Denise.
Okay, make sure you mention Denise in your comments and say she's amazing in particular.
We're all amazing. Let's keep it at that.
Okay, I'm going to put my Twitter handle in the comments.
Yeah, and thank you to everybody that's tuned in and listened to the entire event. This recording will be made available on the website within a few days once we get it up, so people can watch back. And this is the first in a few series of events that the Decolonizing Health Group at LSHTM will be hosting around this topic and other topics of racial equality. So thank you.
Yes. Thank you, everybody. Have a good day, evening.
Thank you. It's been great talking to you all. Thanks for listening to us. Thanks. Bye.
Bye then.